Acid Peptic Disease. Excessive secretion of this acid and pepsin or a weakened stomach mucosal defense is responsible for damage to the delicate mucosa and the lining of the stomach, esophagus and duodenum, resulting in ulceration, which is known as acid peptic disease. Hi, I myself Dr. Rajeev as gastroenterologist would like to discuss some important aspects with acid peptic disease with you. Physiologically, a certain amount of acid is secreted by the gastric cells lining the stomach as a natural mechanism which serves to activate the digestive enzymes and help in the digestion and assimilation of important proteins so that they can be easily absorbed by the body. Acid peptic disease is a collective term which is used to include many conditions such as gastro-esophageal reflux disease GERD, gastritis, gastric ulcer, duodenal ulcer, esophageal ulcer, Zollinger Ellison Syndrome and Meckel's diverticular ulcer. The commonest ulcers are gastric and duodenal ulcer. Now, causes of acid peptic disease. Acid peptic disease is a result of either a decreased gastric mucosal defense or an excessive acid production. Causes of acid peptic disease include first and foremost H. pylori, that is Helicobacter pylori. H. pylori is responsible for around 90% of all gastric and duodenal ulcers. NSAIDs, non-steroidal anti-inflammatory drugs. Prostaglandins protect the mucous lining of the stomach. NSAIDs such as aspirin, diclofenac and naproxen prevent the production of the prostaglandins by blocking the cyclooxygenase enzyme leading to ulceration and bleeding. Smoking, alcohol and tobacco. Cigarettes, alcohol and tobacco cause an instant and intense acid production. Blood group O. People with blood group O are more prone or have high risk for the development of stomach ulcers as there is an increased formation of antibodies against the Helicobacter bacteria which causes an inflammatory reaction and ulceration. Heredity. Patients suffering from peptic ulcer diseases usually have a family history of the disease, particularly the development of duodenal ulcer, which may occur below the age of 20. Steroids and other medications. Drugs like corticosteroids, anticoagulants like warfarin, niacin and some chemotherapeutic agents and aldactone can aggravate or even cause ulcers. Diet. Low fiber diet, caffeinated drinks such as tea, coffee and fatty foods are linked to peptic ulcer. Then other diseases like chronic liver disease, lungs disease and kidney disease, especially tumors of acid producing cells, all predisposed to peptic ulcers. Zollinger Ellison Syndrome. It is a rare precancerous condition which causes the peptic ulcer disease. It is a syndrome disorder wherein tumors in the pancreas and duodenum, also known as gastrinomas, produce a large amount of gastrin, which is a hormone that stimulates gastric acid secretion. Endocrine disorders such as hyperparathyroidism are also implicated in the development of peptic ulcers. Stress and neurological problems can also be associated with the Cushing ulcer and peptic ulcer. Now, friends, we will discuss the symptoms and signs of acid peptic disease. Now, first, symptoms of peptic ulcers include such as abdominal pain, nausea, water breath, vomiting, abdominal fullness and loss of appetite, early satiety and weight loss. Peptic ulcer disease is usually a chronic problem with a natural history of relapse and remission which can last for over 10 years or even more. Gastric and duodenal ulcers usually have common symptoms such as abdominal pain, a burning pain in the upper part of the abdomen, usually related to the meal times, together with fullness, distension of abdomen, bloating, with or without nausea and generalized discomfort, also known as dyspepsia. The pain is usually so sharply localized that the patient can often indicate the exact place with 2 or 3 fingers or hand, called the pointing sign. Gastric ulcer pain is more after the ingestion of meals, while duodenal ulcer occurs more due to hunger. Nausea, heartburn, vomiting, loss of appetite and weight loss are other symptoms which are associated. Gastric outlet obstruction. The ulcer could heal with scarring and result in narrowing of the gastric or intestinal lumen. This could cause an obstruction to food being passed forward. Vomiting or passing blood in the stool. Signs of bleeding as vomiting of the blood or black cherry color of the stool can be seen. Bleeding and perforation from the ulcer. Bleeding from the site of the ulcer with the thinning of the wall may result in perforation. Now, Friends, we will discuss what is the difference between gastric and duodenal ulcers. Depending upon the duration, peptic ulcers are classified into acute and chronic. Gastric ulcers develop more often in the elderly age after the age of 60, while duodenal ulcers occur around the age of 30 to 40 years. Gastric ulcers are more common in females while men suffer more common from duodenal ulcer. Chronic duodenal ulcer rarely develops into cancer while chronic gastric cancers are potentially precancerous. Chronic gastric ulcer is usually seen on the lesser curve of the stomach while usual area of occurrence in a duodenal ulcer is first part of the duodenum. Peptic ulcer is diagnosed by using blood and stool test, breath test, endoscopy and rarely now barium radiography. Complications include bleeding, perforation, obstruction in the digestive tract and sometimes cancer. Now differential diagnosis or other possibilities include pain in upper part of the abdomen is usually seen in the following conditions besides peptic ulcer disease, such as pancreatitis, cholecystitis, bile duct inflammation and biliary colic secondary to the stones in the gallbladder, hepatitis or hepatic congestion, stomach cancer, pericarditis, that is inflammation of the covering of the heart which is called as pericardium, pleurisy, inflammation of the covering of the lungs, that is pleura, myocardial infarction or heart attack, which includes stable angina as well as unstable angina. Now complications does it include such as besides having sleepless nights due to pain and other dyspeptic symptoms, bleeding, perforation, penetration into other organs and obstruction in the intestine are other complications which can develop due to chronic or acute acid peptic disorders. Barrett's esophagus, which is a precancerous lesion which develops due to chronic GERD or gastro-esophageal reflux disorder. GERD is a condition wherein the liquid contents of the stomach regurgitate back into the esophagus. This causes damage to the esophageal lining, resulting in esophagitis and Barrett's esophagus. Infection with H. pylori, responsible for peptic ulcer disease, can cause an atrophy of the stomach, which is called atrophic gastritis, which is a precancerous condition. Duodenal cancer is also a complication of APD. Now diagnosis. Before instituting therapy, it is imperative to diagnose the ulcer disease and H. pylori infection, because treatment protocols are variable for different types of the ulcer diseases. The treatment of NSAID-induced ulcer differs from ulcer which is caused by H. pylori. Clinical history. Medical and family history established where the ulcers are present in the family. Other information such as misuse of drugs such as NSAIDs, medicines taken, and information regarding the use of alcohol, smoking and tobacco should also be elicited. Also, the timing of food in relation to the pain and dyspepsia may help in diagnosis. Blood tests. Blood tests such as enzyme-linked immunosorbent assay ELISA help in measures of antibodies to H. pylori. Serum gastrin level should be measured in patients with multiple ulcers to consider gastrin-secreting tumors or Zollinger Ellison Syndrome. Then stool test. Stool test detects the presence of H. pylori in the fecal matter and also establishes whether there is any recurrence after antibiotic therapy. Then breath test. UBT, urea breath test, is helpful in the detection of H. pylori, especially eradication. The patient is made to drink a liquid containing carbon-labeled urea, which is broken down by the bacteria. The patient is subsequently asked to breathe into a sealed bag, which is tested for the presence of labeled carbon. A positive test indicates the presence of H. pylori infection. Then endoscopy. Endoscopy is considered a more accurate test for the diagnosis of peptic ulcer diseases and also helps in taking biopsy of the affected area. Barium radiography, which is seldomly done nowadays. X-rays are taken of the stomach, esophagus and duodenum after swallowing barium, and the retention of the contrast in the ulcer is monitored. Now friends, let's come to the treatment of the acid peptic disease. Acid peptic disease is treated with drugs that reduce the acidity and sometimes in addition with certain antibiotics to eliminate H. pylori infection causing this condition. Surgery may be needed in very rare cases in cases of complication. Now first we will discuss the medical management. Diet. Dietary therapy relates to the avoidance of spicy and oily foods which increases acid production and are difficult to digest. Avoid tea and coffee, alcohol, aspirin and other NSAIDs, chocolate, tobacco and cigarettes. Meals should preferably be light and at small intervals. Then eradication of H. pylori. The three-way approach to eradicate H. pylori involves diagnosis, treatment and confirmation of the cure of H. pylori infection. The standard protocol to eradicate H. pylori involves the use of 2 or 3 antibiotics, example amoxicillin, tetracycline, clarithromycin, metronidazole, and the use of proton pump inhibitor, example esomeprazole, omeprazole, lansoprazole, rabeprazole as well as pantoprazole, with or without bismuth compounds for around 2 to 3 weeks and repeated if there is recurrence. Avoid NSAIDs or the concurrent use of prostaglandin analogs such as misoprostol may be prescribed to prevent peptic ulceration, especially due to NSAIDs. Use of antacids or S2 receptor blockers such as cimetidine, ranitidine, famotidine and nizatidine, which help in reduction of gastric acid secretion and in turn increase the gastric pH and reduce the secretion of the pepsin. Now the treatment of peptic ulcer complications includes a blood transfusion for hematemesis and melena, use of antacids and S2 receptor antagonists for pain, and the treatment of peritonitis in case of perforation of peptic ulcer disease in the form of surgery. Maintenance with H2 receptor antagonist is usually effective and relatively safe. Now surgery is the last resort. Surgery is basically reserved for medical refractory cases as well as complications. Surgical treatment of ulcer may be indicated of patients with failure to respond to any PPI or any such therapy, any dietary intervention or any healthy lifestyle, even complications such as increased pain, bleeding, obstruction as well as perforation. So friends, thanks for watching this video with patience, and I just pray you all to be very healthy, wealthy and prosperous in every sphere of life.